My name is Kim, Kim Lippard, Lippard, and I am the clinic manager for the Monoclonal Antibody Clinic here at Vanderbilt.
Perfect. So for those who don't know, could you just kind of talk about the monoclonal antibody treatment, what it is and what it's used for?
Sure. So the simplest way to explain it is anytime you get sick, your body naturally produces antibodies. That's what helps fight off infection. So the monoclonal antibodies are lab-created antibodies that were made to mimic the body's natural response to fight COVID off. So these are specific antibodies for COVID. The main goal of the antibody treatment is to keep individuals out of the hospital. So it can help decrease the length of symptoms, also decrease the severity of symptoms in order to help individuals be more successful with fighting off the COVID virus.
And what is the efficacy of this drug, the success rate?
So studies have shown that individuals that receive monoclonal typically have a 70% success rate of staying out of the hospital. So they can be extremely helpful with keeping individuals out of the hospital.
Right. And how much does this cost?
So the antibodies themselves are still covered by the federal government. So we don't bill for that. What I hear most other organizations are doing is billing for the service of the infusion. And so, that can vary. It is covered by insurance. And so we've not had any issues with individuals, not being covered by insurance.
Got it. So obviously the reason why we're doing this story, what do you make of the new state Department of Health's guidance on prioritizing this treatment for those most likely to be hospitalized?
We've been prioritizing since the beginning. So we began doing these infusions November of last year. And our goal has always been to prioritize individuals that are at highest risk. I think the new guidance that's coming out is that screening or how we're considering patients should also include whether individuals are vaccinated or not. I think it's important to highlight that what's not being said is just because you're fully vaccinated means you are automatically not eligible for antibodies. We know that there are certain groups of individuals that even when they're fully vaccinated, don't mount as much of a response as we would like to the vaccine. And so they're still at high risk. So those individuals include our senior population, 65 and older, individuals who have immunocompromised issues. So our cancer patients or transplant patients, those individuals are still eligible. But what I think it does do, and I agree with, as we are potentially going to see changes in the amount of doses that we get, is we do need to consider, who is most at risk and making sure that they, are kind of first in line for priority.
Do you feel the vaccinated are being pushed to the side a little bit when it comes to this new guidance and the prioritization of who is receiving these treatments, when there's short supply?
You could look at it that way. I mean, I think the other way to look at it is the individuals that have gotten vaccinated have done their job and already have a level of protection against severe COVID disease that could lead to hospitalization or death than those individuals who are not vaccinated or that are not fully vaccinated. And so individuals who are not vaccinated are 10 times as likely, to end up in the hospital, significantly more likely, to progress to death. So I don't think it's excluding. I think it's making sure that we're using the resources appropriately, especially as we look at the potential of seeing a decrease in the supply that we have.
What do you say to those who are fully vaccinated who feel frustrated with this new guidance? Because I've seen a lot of people on Twitter and feel like they're, kind of like the question that I asked before, they feel like, because they did something that they felt was right, if they're kind of, they feel a little bit frustrated with that new guidance and, they're prioritizing people who have a choice to get vaccinated but didn't get vaccinated.
Yeah, so I get where they're coming from and I get the frustration. And I don't necessarily have an excuse to say this is why you shouldn't feel frustrated. I think for somebody, myself that is vaccinated, you did the right thing. And should you get COVID, you would like to know that there, is the option available. I think the flip side of it is that already the majority of individuals that we're infusing are unvaccinated and are our high-risk population. So, I don't know what area organizations are doing, if there's kind of an open door policy for anybody that wants it. That's not how we've been because of the sheer volume of patients that we're seeing. But the first thing I would say is thank you. Thank you for getting vaccinated, and thank you for doing your part to help with this pandemic. And to just have a realization that there is a reason why the guidance has come out, and we want to make sure that we're protecting those that are at highest risk.
Right. How is the antibody treatment supply at Vanderbilt right now? How much allocation do you guys have? Are you guys in short supply?
We're not currently. We monitor that closely. So our pharmacy team members and the individuals that are responsible for ordering those and ensuring our supplies communicate very well. At this time, we have enough doses, but there's an unknown. We don't know how the changes and how the ordering occurs and how the allocations to the state is going to affect us. We've done a lot of antibody infusions, and so we are hopeful that we will be able to get close to what we've been getting. We just don't know at this point.
How many antibody infusions have you done? Is there a number that you have?
Yeah, we began doing these in November of last year. Total, as of this week, we have done almost 3,700 infusions. I like to highlight that over 2,000 of those have been done just since July 1st. So there has been a significant increase with the Delta variant in Middle Tennessee and individuals testing positive and, having a desire to get the antibody infusion.
Right. How many doses are you guys allocated each week? Is it, or each month, or how does that work?
I don't have a number for that.
Okay.
We get regular shipments. I know current state, we have enough to get through the end of next week. We have not been told what our allocation will look like following that. So, at this point, until we get that news from the state, the way it was previously working is we would just order directly from the manufacturer. And we essentially were getting what we asked for. But now that is being restructured, and the federal government will decide how many doses each state gets, and then the state gets to decide how many doses each location gets. And so that's a brand new process, and we just don't have a feel for how that's going to impact our supply.
And just to be clear, that even if you are vaccinated and you are a breakthrough case and you're hospitalized with COVID-19 and you're fully vaccinated, you're not going to automatically be turned away for these antibody treatments.
So one of the criteria, the focus of the antibody treatment is mild to moderate symptoms, not hospitalized due to COVID. So if somebody's COVID has progressed to the point that they need to be hospitalized and that they need oxygen because of COVID, they're not a candidate anyway for the infusion. So what we focus on is mild to moderate symptoms, and the goal is to intervene with the antibodies before an individual progresses to severe symptoms and needs hospitalization.
Got it. So minus the hospitalization part, if you're fully vaccinated and you are categorized as someone who could be able to get the monoclonal antibody treatment, it's not an automatic turn away.
Yep. So fully vaccinated does not automatically disqualify you from antibody treatment. There are a lot of other things we look at: age, medical diagnoses, your medical history, those type of things. So for those individuals out there who have significant medical problems or that are in our older patient population and they're fully vaccinated, if they were to get COVID, they are not automatically disqualified from the antibodies. It's just that we are now being asked to use vaccination status as kind of one more checkbox, one more question we're going to ask to determine eligibility and to determine where in the priority list somebody falls.
And is there a point where you'd change that guidance? Because I know the state says that it comes down to the provider's clinical judgment. Mm-hmm. Is there a point where you guys would get rid of this guidance and just kind of go off of who comes, who's here? Does that depend on supply, or kind of where does that lead?
Yeah, so we have not had an open door policy. At no point have we said, if you test positive for COVID and you want the antibodies, come on in. We have not had enough supply for that. And quite honestly, we couldn't staff it. I mean, right now we're doing 80 infusions a day. If we had a complete open door policy and just said, hey, if you've got COVID and you want this, come on, we would have to be able to do hundreds a day. So we don't have the capacity for that. So again, we've been doing screening since the beginning of this. It's not new. We're just now being asked to add in another layer.
Got it. Great. Is there anything else you want to add, or anything you think I missed or want to clarify or say? Because I know it's a pretty heated topic right now, and a lot of people feel very opinionated one way or the other on this. So I don't know if there's anything else you wanted to clarify or.
Yeah, it is a very opinionating subject. My big thing that we always try to highlight is vaccination is important. The antibody treatments are not a substitution for vaccination. The number one most important thing that individuals can do is to get vaccinated. Again, we still have criteria in place to make sure that those individuals, regardless of vaccination status, who are at high risk, have the ability to get the infusions if they need it.